with the conclusion is Dr. Barbara Smith, director of the Comprehensive Breast Health Center at Massachusetts General Hospital. She joins us this morning from Boston. Dr. Smith, good morning.
Good morning.
Women have been hearing conflicting recommendations for several years now. What advice would you give women in their 40s?
As I see the evidence that exists today, it favors having mammograms between 40 and 49. The update that was recently gotten from Swedish studies really does show a survival benefit for women who have screening in this age group.
How big a survival benefit are we talking about?
Well, the Swedish studies showed 35 and 44% survival improvement. If you combine this with some older studies, the overall benefit's probably somewhere between 17 and 24%.
Now, those who recommend against having mammograms earlier than age 50 point out that there are downsides to having mammograms, including the risk of being exposed to radiation. How serious a risk is that in your estimation?
That's right. I think it's quite small. The risk of radiation causing damage to breast tissue in a woman in her 40s is quite low. It's different for younger women, and that's why we don't often do mammograms in the 20s or 30s, except under special circumstances.
There is also the problem, Dr. Smith, of false positives, that mammograms show lumps that may not turn out to be cancerous, but women undergo biopsies and in some cases even surgery, despite the fact that they are benign tumors.
Right. Our tests aren't perfect yet and aren't perfect at telling the difference between benign and malignant. We often have to get a piece of tissue to be sure. What's happening now, though, is more and more women can have their biopsies with a needle. It's much less painful, it costs less, it doesn't leave much of a scar, if any scar. And I think that's the way to look at things. Do the least invasive biopsy, but still get the information.
According to the New York Times this morning, mammograms miss 1/4 of the invasive breast cancers in women in their 40s, compared with missing only 10% of the invasive breast cancer for women in their 50s. They say that this may be because the density of the younger women's breasts. Do you think that in some ways, Dr. Smith, women have been lulled into a false sense of security, given the fact that mammograms are not a panacea? They are not perfect.
Right. They're not perfect. A lot of other studies would disagree with those numbers and say that it's really more like 15% of cancers being missed. But it is true, even with a number like 15%, that a mammogram alone is not enough. A clinical breast exam looking for lumps that can be felt is important, and if you feel a lump, you should have it pursued and worked up, even if the mammogram is negative.
If you feel so strongly about women in their 40s getting mammograms, why do you think so many other respected medical experts have disagreed with you? What do you think the motivation is?
Well, there's a lot of issues that are at stake here, and I think a lot of the people who disagree are good intention, but read the data differently. I think also there are considerations of cost. It's very expensive to do mammograms for a woman in her 40s, and that's an issue we're all having to struggle with. When can we afford tests, and when can't we?
So you think it's an insurance issue in some ways?
Well, I think cost is a big part of what the arguments are, yes.
What other measures should women use or incorporate in their routines to detect, for early detection, rather?
Right, and an examination with a physician or nurse on an annual basis for women in their 40s and beyond makes sense. Doing self-breast exam, looking for lumps or bumps is important as well, because still the majority of breast cancers are found by the woman herself.
Bottom line, I'm 40 years old with no history of breast cancer in my family. If you were my doctor, what would you tell me to do?
I would tell you the same thing that I do myself, which is have mammograms every year.
Every year, not every 2 years, every year.
Every year is what some of the studies are supporting. I wouldn't argue with every other year, but I think what I do myself, and I'm a 40-something, is every year.
And there is no question about it for women 50 and older,
absolutely,
correct?
And I think that's an important thing to take away from this, is there's no debate about mammograms over 50. They save lives there.
All right. Dr. Barbara Smith, thanks so much for clearing a lot of things up for us this morning. We really appreciate it.
Thank you for having me.
And we're back in a moment with more on Today, right after these messages.